Just all my supplies, eye chart, ophthalmoscope, otoscope, tuning forks, popsicle stick, and my badge. Hello, my name is Ryan Ramos. I'm going to be performing your eyes, ears, nose, throat, and lymphatic system exam today. First things first, do you wear any glasses normally?
Nope.
Perfect. Well, let's get started. I'm going to have you read my eye chart with one eye first. You can cover whichever one you would prefer. Can you read I'm going to hold it about 14 inches away from your face. Can you read the smallest line you could see?
LTFPH.
Can you switch eyes? Read the smallest line you can see.
LTFPH.
Okay. Now can you read it with both eyes? Smallest line?
LTFPH.
Very good. 20/20 vision. Perfect. Next I'm going to do a visual like field of acuity test to test your peripheral vision. So I'm going to get down on your level, and then you're going to see my fingers wiggle. As soon as you see it, just say now. Okay?
No. No. No.
Okay. Can I have you cover one eye? And then when you see my fingers wiggle, just say no.
No.
All right. Can you switch?
No.
Perfect. There's no issues with your peripheral vision. You were able to see it about the same time I was able to see it as well. Next, we're going to move on to more eye tests. Let's see. I'll have you check your gaze. I'm going to have you follow my finger with your eyes, not your head, okay? Perfect. You didn't have any gaze preference. Your eyes move smoothly throughout. No signs of nystagmus or anything like that. Now we're going to do the cover-uncover test. Can I have you cover one of your eyes, please? I'm going to have you stare straight ahead at me. Perfect. Can you switch to the other eye? Very good. Both eyes remain midline. They did not deviate one way or another when the other eye was covered. Perfect. Now I'm going to physically look at your eyes. I already washed my hands as you saw. I'm going to look at your lacrimal apparatuses first. They're nice and intact. No redness, no drainage. I'm going to also look at your sclera. I'm going to open your eyes a little bit more, and I'll have you look all around. I'll explain to you when it comes to. Can you look up, down, left, right? Perfect. Your sclera is nice and white. There's no signs of redness, no yellowness, no signs of scleral edema, no scleral hemorrhage or anything of that sort. They're nice and intact. No drainage. Was there any tenderness when I touched your eye?
No.
Perfect. Okay, looks great. I think for the next couple tests, I'm going to actually dim the lights. That way I can see your eyes a little bit better. Maybe if it wants to connect. Okay. Alrighty, first things first, I'm going to have you look straight ahead at me. I'm going to look at your pupillary reaction. Perfect. Your pupils are round, equal, they react to light, and they also accommodate. I'm going to also look at your corneal light reflex. The light reflex is nice and midline in the center of your pupil. Now I'm going to also look at your corneas, look if there's any opacities or anything of that sort. Very good. Nice and clear. No cloudiness, no signs of opacities. Okay, now I'm going to look closer at your retina / optic disc. Okay, I'm going to just hold my thumb to your eyebrow. I'm going to start midline, and then go towards your lateral position. Very good. Now I'm going to switch to the other side. Very good. There's a red reflex, which is exactly what we want. Your optic disc, or your retina is nice and orangish red in color. Your optic disc is nice and yellowish orange in color. Clear defined distinction. Your disc is also about half the size as your physiologic cup is half the size as your optic disc, which is what we also want. There's a clear distinction between your veins versus your arteries. Your veins are nice and thick, prominent, versus your arteries are nice and thin and lighter in color. And there's also a clear distinction on when they cross. There's no signs of papilledema, there's no drainage, anything of that sort. Everything looks very symmetric in shape as well. I think I'm done with that. Actually, I'm gonna turn the light back on because we're gonna move on to your ears. I'm gonna start by just palpating your ear and looking at it. Can you tell me if there's any tenderness of any sort? I'm gonna start at the top of your pinna, down to your lobe. Any tenderness?
Nope.
Okay, I'm gonna flip it around. No masses, no skin breakdown, no lesions, anything of that sort. No obvious drainage. Your tragus, any tenderness with that?
Nope.
Okay, let's move over to the other side. Any tenderness?
Nope.
Okay, there's no masses, lesions. Your tragus, there's no tenderness with that either?
Nope.
Okay. Or obvious signs of drainage or breakdown on either ear. I'm gonna next look inside of your ear at your canals and your tympanic membrane. Check my covers on. Okay. Moving along. Okay, I'm gonna brace my hand on your ear. I'm gonna lift it up and back. Put the scope in first before looking. Okay. Your tympanic membrane is nice and pearly gray. There, your canals are also nice and clear. There's no excess wax on that side. No redness, no drainage, any signs of infection of that sort. I'm gonna lift your ear up and back again, insert my scope, and look. Very good. Your tympanic membrane is also nice and pearly gray. Your ear canals are nice and clear, no excess wax, no drainage, no redness, signs of infection of that sort. I'm gonna move on to the whisper test. I'm gonna have you cover up one of your ears. I'm gonna say a 2-syllable word. I'm gonna whisper it. Can you just repeat what I say?
Football.
Perfect. And the other ear?
Pumpkin.
Very good. Even though you passed the whisper test, I'm still gonna do the Ryan and Weber test. First things first, I'm gonna put my tuning fork on top of your head. I'm gonna strike it with my other fork. You let me know if you can hear on both ears equally or one more than the other, okay?
Okay. Equal.
Very good. Next, I'm gonna move on to the next test. I'm gonna put it on your mastoid, and then I'm gonna strike it, and then when you stop hearing it, let me know, and I'm gonna flip it over, and you let me know if you can still hear it, and then when it stops.
Okay. Now.
Very good. Moving on to the other side.
Now. Now.
Perfect. Symmetric on both sides. You stopped hearing it about the same time within a few seconds. Moving along to the mouth. I'm sorry, no, we're gonna move on to the nose first before we think about the mouth. I'm gonna first actually look at the external part of your nose. Any tenderness when I palpate?
No.
Your nose is nice and symmetric. No masses, no skin breakdown, no lesions, sores, or anything like that. I'm going to palpate your frontal sinuses. Any tenderness with that?
Nope.
Okay, and your maxillary sinuses. Any tenderness?
Nope.
Very good. All right, now I'm going to look inside of your nose. Okay, your nasal passages look nice and clear. There's no obstructions, no masses, polyps, sores, lesions, anything of the sort. No bleeding, no drainage. Looks really good. Next, we're going to have you do the patency test. Can I have you occlude one side of your nose? Breathe in and out. Perfect. And the other side? Perfect. It sounds patent on both sides. No signs of obstruction, which is perfect. Now I'm going to move on to your mouth. First things first, I'm going to look at your lips. They look nice and pink, symmetric in shape. No breakdown, no lesions, no masses, anything of that sort. Now I'm going to look at your gums or your gingiva and your teeth. Very good. Oops, sorry. Your gingiva is nice and pink. It's not receding. Nice and moist as well. Your teeth are all intact. No obvious signs of decay or caries. Looks very good. Next, I'm going to be moving on to your hard and soft palate, your tonsils, your pharynx, your tongue, all of that fun stuff. I'll try to be quick because I know you have a gag reflex. So open up real big. Okay, hard palate looks really good. Nice and pink and moist and intact. No drainage of any sort. No masses, no obstructions. Now I'm going to move to your soft palate. Can you stick your tongue out and say ah? Stick your tongue out more. Okay, soft palate is nice and pink. Your tonsils are also nice and symmetric. About a +1, I would grade them, not swollen. There's no, say ah one more time, sorry. Let me look a little bit closer. No exudate, drainage, or anything of that sort. Your uvula is also nice and midline. It doesn't go one way or another. Let me see your tongue real quick. Perfect. Your tongue is nice and pink and midline. Your entire mouth is nice, pink, moist, and intact, I should also say. Your tongue is also midline. There's no sores, there's no masses, no obstructions or anything like that in your mouth. Exactly what we want. Now,
Sorry, bug.
Now I'm going to move on to your lymphatic system. I'm going to palpate your lymph nodes. You just let me know if there's any pain or tenderness, okay? Your preauricular, your postauricular, your occipital, your submandibular, your tonsillar, your submental. Now I'm going to move on to your carotids. I'm going to do them about one side at a time. Your superficial carotid, your posterior carotid, your anterior carotid, very good. I'm going to move to your supraclavicular and your infraclavicular. Any pain or tenderness with any of those?
No.
Very good. They were non-palpable, which is great, and since they're non-tender, that is considered normal. Okay, and that concludes my exam. Thank you so much for your time.
Thank you.
You're welcome.